Eprosartan is an ARB used to treat hypertension, diabetic nephropathy, and congestive heart failure. In this video, let's find. What is Eprosartan? What is Eprosartan used for? Contraindication. What are the side effects of taking Eprosartan? How does Eprosartan work? How to use Eprosartan? What is Eprosartan? Eprosartan, sold under the brand name Teveten among others, is an angiotensin II receptor antagonist used for the treatment of high blood pressure. Eprosartan is sometimes paired with hydrochlorothiazide. As with other angiotensin II receptor antagonists, Eprosartan is generally better tolerated than enalapril, an ACE inhibitor, especially among the elderly. What is Eprosartan used for? For the management of hypertension alone or in combination with other classes of antihypertensive agents. Also used as a first-line agent in the treatment of diabetic nephropathy, as well as a second-line agent in the treatment of congestive heart failure, only in those intolerant of ACE inhibitors. Contraindication. In patients who are elderly, volume depleted, including those on diuretic therapy, or with compromised renal function, co-administration of ARBs with drugs that affect RAAS may increase the risk of renal impairment, including acute renal failure, and cause loss of antihypertensive effect. Side effects. Eprosartan use can result in a lightheaded feeling, like you might pass out, little or no urination, or high potassium level nausea, weakness, tingly feeling, chest pain, irregular heartbeats, loss of movement. Pharmacodynamic. Angiotensin II, the principal pressure agent of the renin-angiotensin system, is formed from angiotensin I in a reaction catalyzed by angiotensin-converting enzyme, kinase 2. It is responsible for effects such as vasoconstriction, stimulation of synthesis and release of aldosterone, cardiac stimulation, and renal reabsorption of sodium. Eprosartan selectively blocks the binding of angiotensin II to the AT1 receptor, which in turn leads to multiple effects including vasodilation, a reduction in the secretion of vasopressin, and reduction in the production and secretion of aldosterone. The resulting effect is a decrease in blood pressure. Mechanism of action. Eprosartan blocks the vasoconstrictor and aldosterone-secreting effects of angiotensin II by selectively blocking the binding of angiotensin II to the AT1 receptor found in many tissues, example, vascular smooth muscle, adrenal gland. There is also an AT2 receptor found in many tissues, but it is not known to be associated with cardiovascular homeostasis. Eprosartan does not exhibit any partial agonist activity at the AT1 receptor. Its affinity for the AT1 receptor is 1,000 times greater than for the AT2 receptor. In vitro binding studies indicate that Eprosartan is a reversible, competitive inhibitor of the AT1 receptor. Eprosartan has also been shown to bind to AT1 receptors both presynaptically and synaptically. Its action on presynaptic AT1 receptors results in the inhibition of sympathetically stimulated noradrenaline release. Unlike ACE inhibitors, Eprosartan and other ARBs do not interfere with response to bradykinases and substance P, which allows for the absence of adverse effects that are present in ACE inhibitors, for example, dry cough. Half-life. The terminal elimination half-life of Eprosartan following oral administration is typically 5 to 9 hours. Dose. The dose of this medicine will be different for different patients. Hypertension. Initial, 600 mg p.o.q. day, in patients without intravascular volume depletion. Maintenance, 400 to 800 mg/day p.o.q. day or divided q12 HRPO, twice daily may improve effect. See also combo with hydrochlorothiazide, Teveten HCT. Generally adjust q-month, more aggressively in high-risk patients. Safety advice. Pregnancy category C, first trimester, and D, second and third trimesters. See warnings, fetal/neonatal morbidity and mortality. Eprosartan is excreted in animal milk, It is not known whether eprosartan is excreted in human milk. That's all the information about eprosartan we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.